Today, this session, we will be looking at the topic, partnership to promote midwifery, using the International Childbirth Initiative as a framework to encourage leadership and professional collaboration. To do justice to this topic, we have a team that is going to do it. They're going to tell us about collaboration, which is a cornerstone of effective, safe, and respectful maternity care. The International Childbirth Initiative framework centers the role of midwife in the provision of respectful care and creates a space to allow for increased understanding and promotion of midwifery across countries where midwifery has not been integrated. The goal of the initiative is to promote practices that allow for safe physiological births, including promotion of the midwifery philosophy and access to continuous support. The need for midwives is greater than ever as globally we observe a trend of increasing maternal mortality and sharply increasing rates of cesarean births. This panel at this session will introduce the initiative with midwives speaking from participating health facility in Chile, India, and the Philippines about their experiences of collaborating with their community, physician, administrator, and policymaker through the initiative platform. Join me to welcome the team as they do justice. Thank you very much.
And today we have Ronny Valenzuela, Vicki Penwell, and Vijaya Krishnan, as well as Dr. Andre Lalonde, who's a team member as well as Michelle, who is our I'd say slide advancer extraordinaire, but today that is Vicki. So thank you so much for everyone being here, and I look forward to your presentation.
Thank you, everyone. We're happy to be here and to be able to share today about the International Childbirth Initiative on the International Day of the Midwife. So I'll be starting out here. I think I will. There we go. So the International Childbirth Initiative is abbreviated as ICI. And what this is it's a framework for implementation of safe and respectful care practices and policies. It has 12 steps called the 12 Steps of Safe and Respectful Mother-Baby Family Maternity Care. And that's not a typo. Mother-baby is always put together as one word, trying to remember that mother and baby should always be together. ICI provides a global resource networking striving to share learning and improve the provision of care. And as you can tell from our panel, we have ICI implementing sites all over the world. ICI was created by the International Mother-Baby Childbirth Organization, along with the International Federation of Gynecology and Obstetrics. They were able to merge their steps some years ago with collaboration from the International Confederation of Midwives and the International Pediatric Association and the White Ribbon Alliance. So you can see that all of the providers of maternity and newborn care, the midwives, the obstetricians, gynecologists, the pediatricians, also the International Nurses Association has also endorsed. So everybody that's a provider involved in birth now has become a part of ICR, signed on, endorsed. There's already over 40 partner organizations, and it's growing. And Mercy in Action, the organization I'm with, is proud to endorse as well as implement. ICI is open to all birthing facilities that are willing to commit to delivering safe and respectful mother-baby family maternity care. So we have the address where you can write, icichildbirth.org. I'm hoping after this talk that Michelle will be getting lots of letters saying, how can I become an ICI site? It really is such a great thing, and we'd love to see every facility where babies are being born all over the world be implementing these 12 steps along with us. So I'm going to talk first about how we use the ICI 12 steps of safe and respectful care as a framework to encourage leadership and professional collaboration in the Philippines, where I live and have worked for the last 35 years. So we'll be starting there. I'll tell you a little bit about my organization. Mercy in Action is a nonprofit organization that operates an accredited college of midwifery in the United States. And then we also build and support midwife-led birth centers in the Philippines and have done that since 1991. And we also do capacity building globally, as well as a lot of consultation globally. We've implemented the ICI 12 steps for safe and respectful mother, baby, family, maternity care into everything we do since the inception of the concept. And we have kept detailed records and statistics, and we can show that that the use of these steps, this concept of care, it results in excellent clinical outcomes, as well as high patient satisfaction, and has helped our student midwives with engagement as well. So I want to say since 1991, when we started working with birth centers in the Philippines, was around the time that the first mother-friendly documents were being written up. Prior to that, we had the baby-friendly steps, which many of you are probably aware of, and we were following those. And then back at some point, the Coalition for Improving Maternity Services started a steps called Mother Friendly. They interviewed hundreds of midwifery, birth, and breastfeeding organizations in hundreds of countries to come up with the steps. It went through a few name changes along the way and eventually merged with FIGO's steps, I think 2020. So in its current form, this is a framework that has been around now for at least 5 years, and we're trying to really get the message out that that the ICI has there's so many uses and so many ways where it makes the provision of maternity care better. We're also, and I might mention, we have kept statistics on about 18,000 babies born, and our statistics are coming out 4 times better survival rates than the country we're in. So it really is having an impact physically and on outcomes and on survival rates. We have also integrated the steps into our 4-year Bachelor of Science in Midwifery College, and we have a thread of those steps throughout the entire 4 years. The steps are also an integral part of our postgraduate diploma in midwifery and maternal child health. We have students and scholars in that program from every continent except Antarctica at this point, and so the ICI is they're learning about that there, and then wherever we teach any of our workshops or seminars, we also talk about ICI because we just believe in it so much as a really powerful framework to change outcomes, to change perceptions, and like I said, I'll talk about this a little bit later, but very high patient satisfaction. So we were asked to talk today about leadership and collaboration. The ICI calls on leaders really to be models, and I love that we as the leaders in midwifery, whether it's practical, clinical midwifery education, we're the models for respectful, dignified, compassionate, and culturally sensitive care. The ICI within its steps encourages leadership through teamwork, and it brings together all the providers of maternity care, midwives, physicians, nurses, doulas, community health workers, and everybody working together with shared decision-making with the patients, the parents, the families to improve health outcomes. And ICI really emphasizes transparent leadership that uses patient and family questionnaires to gather feedback and drive our quality improvements, the equity and responsiveness to the needs of women and their families. And I want to say about that we actually can literally point to the steps on our wall, that they're actually on our walls and big posters everywhere. We hold these values and best practices front and center in our clinics. All the patients that come in, all the professionals that come in, everyone we interact with, they see what we do. And it is changing the conversation about what birth can be. And it can be both safe and respectful in the same facility. And what I love about the ICI 12 steps is that they cover both. They really hold a very high standard for physiological birth and holding the normal, and yet they also have a roadmap for dealing with the social determinants of health, and the emergency care and the collaborative care that's needed whenever birth goes outside of normal. Very, very helpful in helping us promote teamwork with referring doctors and hospitals, because it's a standard that's for all of us. It isn't like the midwife's 12 steps, it's the 12 steps for everybody that's involved in the birth of a baby. And the patient questionnaires are so important because you can't pretend you're offering respectful, safe care if the patients themselves are not saying you are. And so this is really a very bold move to say, we want everyone to fill out this questionnaire. We want the woman having the baby, the family, tell us your story. Tell us if we followed these steps. And each question in the questionnaire is connected to a step. So we get this real-time feedback. In Mercy in Action, what we've done is hired an independent person, not a midwife or a deliverer of services, that looks at all the surveys, that can call the families afterwards and ask how their care was. And then she meets monthly with the midwives to go over those and debrief and make sure that we're keeping our high standards. And then professional collaboration. ICI calls for systems where professionals work together across the whole spectrum of care, all the way through pregnancy, birth, postpartum, ensuring that we have coordinated care that's the very best it can be. And we also really like that ICI promotes this mutual respect among midwives, physicians, nurses, doulas. We work with community health workers to accompany the parents through the first 1,000 days, and they're all a part of ICI. So the emphasis is on collaborative care so that there's safety and satisfaction both. And ICI also highlights the importance of engaging women and their families as active partners, as I've said, in shared decision-making. So it really centers the family having the baby, the mother-baby pair, ensures that all the services are that wonderful combination. We keep saying respectful and safe. We don't have just one or the other, but both, and that they're accessible to all. And so that collaboration around the care is just one of the brilliant parts of the steps. Whenever there's any conflict with natural birth or the way midwives provide care out of a hospital, it's usually easily settled by being able to point to the steps rather than argue a model of care or argue a perspective of a particular practitioner. It really holds us to that great high standard and collaboration. My slides are sticky. There we go. Okay, that's the end for my part. This is a picture of one of our giant posters on the wall. There I'm shown with Narissa, who is has 2 ICI centers that are supported by Mercy in Action. And now I'd like to turn this over to Ronny to talk to us from his site in Chile.
Hi all, it's really nice to be here today with you celebrating the International Day of the Midwife. My name is Ronny Valenzuela. I'm a midwife from Chile, and I work at La Florida Hospital in Santiago, which is the capital of the country. And I want to tell you a little bit about our experience with ICI. La Florida Hospital was founded in 2014, and the maternity ward was started working on May, actually 2015. So we are 1 week away from our 10th anniversary. We have approximately 2,100 births in 2024. And as I said, we have been working with ICI for about 4 years already. And when we met, we made an excellent match because La Florida Hospital was born with the idea of a humanized, respected birth from the beginning. So we try in each birth to make something special, always safe, but always special. It's probably for us as practitioners, it's a day-by-day job. We see many births, but for the women and the family, is something special during their lifetime. So we try to accompany that, and we try to make them feel that they are in a safe environment, but where they can say what they want and they can say what they like, and they can share also their fears with us. So that way we can make the whole experience more satisfying for them. Next slide. Thank you. A hospital is a building with white walls, white lights, but we try to make it special and meaningful. On your left side, you're going to see the first picture of the hospital when we received the accommodations. And bigger on the right side, you're going to see how it is today. It's painted. We have big balls for women to sit on to relieve pain. So we try to change what we had in the beginning, and not just having a hospital itself, but having a place to give birth, which will be more meaningful to all women. Next slide. This is our birth room, and as you see on the first image in the left, this was the whole beginning. This is the tub, the hot tub that women can get in during the labor. So this way they will help to manage the pain. And the center picture is how we receive it. It was white. We put some stickers on it. So we have a space which seems to be really clinical at the beginning. But in the two pictures at the right, you see how we change it. And it's not hard at all to do that. We have a salt lamp, which help us making the mood for women to be relaxed, comfortable, and feeling safe. So that way, it's something that you can all do everywhere in the world. You can make small changes, but with big differences. And we feel that's the most important thing that we can do. Next slide. We have 37 cesarean rate in La Florida, and that number is growing. And we are really worried about that. The increase of the cesarean section has been an issue that we have been facing for the last years, and we haven't had a solution yet. And even though we always advocate for a vaginal birth, we try to make the cesarean section the best humanized way as possible. So you're going to see in these two pictures that we make the tunnel method. So the baby is born and it goes through the tunnel to the mother's chest. So that way it can stay for a few minutes with the mother, with the father, or with the person that is give him company. And we also try to breastfeed immediately. So I don't know if you already saw it, but in the picture on the right, we have 2 babies. So it's a twin birth, and it's something really beautiful that we have. We want to lower this rate, and we are making as much as we can to lower this rate. But in the meantime, we're trying to make it the best way possible. And that's our main idea. That's our main goal. Next slide. We have a model that empowers the work of the midwife. Without a doubt, the confidence from our doctors is what makes us a great team. We are always working together. I had the chance to say in many meetings that I'm absolutely proud of the Chilean midwifery and the bravery of our midwives, the skills that they have, the knowledge, but also the compassion, the way that they help, the way that they make the women feel with company. But in La Florida Hospital, we have a great team of doctors that they believe in us. So they make us also believe in ourselves and the changes that we can make. So in this day, in the International Day of the Midwife, I also praise for the doctors that are with us. So it's always a teamwork. And I think that's one of the keys of having great results. We know that sometimes things don't go the way that we want, but at the end, we will learn together from our own mistakes and we be better day by day. Next slide. And this is why we do it. We work for people, we work for women, we work for families. So that's the main point of our work, is to give the best to them. So you can check on our website and our Instagram, which is really active. And of course, in the ICIchildbirth.org website for more information. So thank you all from Chile, and I wish you again a happy International Midwife Day. Now I will give you Vijaya from India that's going to talk to you. Thank you.
Hello all. It is such an honor and pleasure to be here. And I am doing something. Hold on. Do I have control of the slides?
I think that's you moving them.
Okay. Okay, I think that's it. Okay. I'm so honored and privileged to be here. Happy International Day of the Midwife. A tough act to follow with Vicki and Ronny, but I'll try. We started with ICI, the collaboration with ICI, when it was IMBCO, and we were also a part of their MB-net, which was the mother baby net. And then when it transitioned into ICI, it was really easy to sort of align our practices as they were and sort of implement the 12 steps. And we have been implementing these steps for quite a long time now, since the time that we started the participation with MBNet, which I believe was almost in 2010 or 2011. So I'm going to just wait for a second because sometimes the slides advance too fast. So hang in there. So sorry about this. So this is our birth center. It is, we have 7 rooms. All of the rooms are, we are located in Hyderabad, India. Hyderabad is a city in the southern part of the country. And all of the rooms are obviously, meant to look like the home. But because of our collaborative model of care, and because today we are talking about professional collaboration in order to better mother-baby family outcomes, this end of this hallway, there is the operating theater complex and a level 1 NICU. So the reason why we started Sanctum, it was almost an organic process. There is a severe challenge of increasing cesarean section rates in the country. What we are looking at over here is the percentage. Telangana, which is the state where our birth center is located, has the worst cesarean rate in the entire country. We have in public hospitals at approximately around a 60% cesarean rate. It is slowly coming down with the implementation of some professional midwifery cadres over the last few years, but it is still one of the highest cesarean section rates in the entire country. Also, when you look at the private hospitals, the cesarean rates are about 3 times higher, and generally it's around 80 to 82%. The last statistics that we have from 2023, I believe, is 78%. So about 8 out of 10 women who enter a private hospital in our state will land up with a cesarean section. There are some reasons. It could be because of larger volumes, and there is also an extraordinary emphasis in the southern states on an institutionalization because of they want to prevent maternal and newborn mortality and morbidity. But with the emphasis on institutionalization, there is not appropriate emphasis on evidence-based practices, and practically there is not much oversight. And so that's some of the reasons that we think are increasing the cesarean section rates. And it's alarming. So why Sanctum was born? In 2005, I actually started by teaching Lamaze classes. And when people came to attend, it was 1-to-1 classes that I would teach them. Many of the parents would come thinking that I would teach them exercises. And to their surprise, they would find that they actually had a choice in their childbirth. They had questions that they could ask their care providers, and so many other things that they would learn about childbirth in the current generation, because as we all know, as we move into the urban areas and families becoming more and more nuclear, the wisdom is lost, and the traditional midwives have almost been pushed out of the equation of the maternity care. So anyway, when I would teach them, then we started doing larger and larger classes, and then we found that the last mile was missing, and people would go into the hospital system, and 90% of them who had attended the classes would land up with unnecessary interventions and C-sections. So parents started asking, where can we have this kind of birth? And so we landed up, I was at that point looking for a place to see where we could implement at least some of these practices, and that's where I met my partner, Dr. Jayanti, and she has been since then for the last 18 years my OBGYN partner. So it's a true spirit of collaboration that we have worked in, and so I rented one room in her hospital, and because in our in India there is lack of immediate emergency care services and transportation services, so we thought that if we could have a birth center led by independent midwives, use the collaborative model of care, get in-house OBGYN support. And initially we didn't even know whether this model of care would work, because in the system, like unlike where Vicki works in Philippines, where their midwifery is known, and Ronny in Chile, where midwifery is known, the kind of professional midwifery that we were talking about was almost unknown, and it was just the nursing which would be providing obstetric nursing care. So to sort of pilot the program, we took a room within her hospital where we also had access to emergency infrastructure, and that's how Sanctum was born in 2008. And then we took 2 rooms and 3 rooms, and women are smart that way. They'll end up finding places. For the first 3 years we didn't even have a board, but they landed up finding us, and in 2016 the current setup was born. So obviously all the ICI principles that we are looking at: provide respect and dignity and informed choice, routinely provide mother-baby baby family-friendly care, provide evidence-based practices, enhance wellness. And essentially, this is where we started, that could we enhance wellness, and started with teaching the, the Lama's healthy birth practices. And eventually, we also understood that if we did not increase the number of childbirth educators, that would be of no use as well. So we started teaching Lama's childbirth education. We started teaching seminars for Lama's childbirth educators, and we are proud to say that about 95% of India's Lama certified childbirth educators are a part of our program. So obviously, provider care continuum was at the end of the, in the equation to provide the mother the entire continuum of care. So in this, when we want to sort of focus on it, what I would want to focus today is the collaborative model of care we have today, and the partnerships that we have created as we stand as a freestanding birthing center. Is that we have obviously the OBGYNs. Today we have a full-time OBGYN with us who is sort of, she loves the model of care, and she came into it with that idea, and so we call her a midwife in disguise. But we also have consultants who come in and work with us whenever there are need for interventions. We have physicians, we have pediatricians, obviously, and neonatologists. We also have community support when we need to transport a baby for, say, a tertiary care, an ICU, and that type of thing. So we have all those, what do you call it, the ecosystem that we have been able to create around us to provide the mother, baby, and family the extended sort of support that they would need, right from preconception all the way into postpartum, and wherever with any referrals that they might need. And birth as a human right, I think this is where we automatically have to focus on, because like Vicki said earlier, it's not just about safe care, it's not just about respectful care, it is every woman wants safe and respectful care. And in a country like India, we have the problem of too much too soon and too little too late, and to bridge that barrier is where we need the professional collaboration, where everyone comes together and says, what is my role in this, and how can I make it, while with dignity, with care, with optimal mother-baby, the non-separation of mother and baby. How do we give the best optimal outcomes? And because midwifery throughout research has shown to have better outcomes, not just for natural births, but for all these other things as well. And when it comes to complex needs, oftentimes midwives are sort of limited, whether it's by state practices, licensure, whether it is the place where they practice in, access to services, they cannot often provide complex needs. So as long as care for women with complex needs, and as long as they are in the, the sort of optimal circumstances, they have the safety, dignity, and respect. But when it comes to complex needs, all that goes out in the window. And so therefore, we wanted to also ensure that, for example, we just had an emergency cesarean where the day after the cesarean section, the mom started to develop a chicken pox. And so now we have the entire gamut of people working with us, and then we could transport the baby for IVIG transfusion and all these kind of PIH and all those other things we are able to take care of. Okay, and so I wanted to take a quick minute to talk about the birth statistics that we have, because I think this again proves that what we do actually works. And we had 219 births, and where in a state where there is 82% cesarean section rate, we had a cesarean section rate of 13%. Our prime cesarean section rate was 6.3%. Our second-time moms, we have a lot of moms who come for a VBAC to us because there is such large primary cesarean section rate. So for them, our repeat cesarean rate was 33%, a little bit higher, but over the last 15 years, our VBAC success rates have been close to about 80 to 85%. We could also offer breech vaginal births, and of course, the multiparous mom, most of them have a normal delivery. And in India, episiotomy is cut almost 100% for first-time moms, and our episiotomy rates are around 4 to 5% women receiving epidurals. For the small minority, again, because of the collaborative care, about 1.2%. Lots of complex needs. Our induction of labor rates is 2.29%. And of course, there is some augmentation and other things, but we could keep it as low as 2.29%. Informed consent, skin to skin, everything that the ICI steps, delayed cord clamping, comfort measures, all of this 100%. And we are really, really proud of exclusive breastfeeding at discharge is 98%, and exclusive breastfeeding at 6 months is 99%. And these are the other small things. Gentle cesarean birth practices, 100%. Zero instrumental delivery rates. Are other statistics of postpartum hemorrhage, very little, 1.82%, 0.1% readmissions, NICU admissions at 6.3%, very less preterm birth. So just talking about this just tells us that when we work in a collaborative model of care where everyone works towards improving mother-baby outcomes, good statistics are possible and better outcomes are possible as well. And that's why we do it. Once safe and satisfied and empowered births. This is a proud older sister cutting the cord of her the sibling that has just been born, the skin to skin, and mom and baby talking to each other during the gentle cesarean, and of course an ecstatic water birthing second time mom. And that's our team. We have all our nurses are cross-trained to provide labor support, so they're over and above doing the clinical work. They also do all the work of a doula, and we could not do what we do without their support. My partner, Dr. Jayanti, who has been an amazing champion of this entire model of care. Her daughter, who also consults with us as an OBGYN, my main OBGYN, who is a midwife in disguise, Dr. Dhwani, and our entire team of housekeeping staff. And it's a small team, but we do the work that we need to do. And hopefully we are able to empower and we are able to inspire other people to create these kind of partnerships within their community as well. And of course, ICI Childbirth is always there if you want to implement it, even one of their practices instead of all 12. You could take one and say, how in my facility can I implement, say, step number 3 or step number 5, and that would then help you segue into all the other birth practices. And I'm hoping that a lot, Vicki, Michelle will receive a lot of emails today. Thank you all.
Vicki, you're muted.
Oh. Caitlin, is it okay if I go?
That was great. That was very great. You all agree with me that collaboration indeed is actually a cornerstone of effective, safe, and respectful maternity care. No wonder the results, the collaborative efforts yielded great results. Thank you very much. At this junction, we want to be attending to question and answers with the speakers. Any questions?
Buki, can I go ahead and read out one of the questions because it's for Ronny? I know that he might need to leave.
Please do. Thank you.
So, Ronny, if you're still, I think you're still with us. Oh, okay. I think you didn't answer in the chat, but maybe I wanted to read this out. So Priscilla Hall was asking about the increasing cesarean section rate and the aspects of care to create change.
Well, the increase in the cesarean section has multiple causes. It's women's will, women's fear, pain management. Migration has also to do with it because we have different tradition, cultures, and ways to see how a birth should be. So we are, the La Florida Hospital has 9 clinics that is the primary care for women. So we are working really tight with them into trying to change the perception of a vaginal delivery that is less riskful or risky than a cesarean section. that it has a better recovery, and that the result, the outcome is really good. So we are trying to get back a normal birth as normal because I've said it before and I say it again. We made cesarean section dangerously safe. It's too safe now. So women actually don't see it as a surgery at all. I've asked a group of women, how many surgeries do you have? They say, no, I have none. Okay, so how many births do you have? I have 2, both cesarean section. So it's not the same concept for women, a surgery or a cesarean section. And I think we are responsible also for that, because we took away the risk, and women are not contemplating it anymore. So it's a lot of work. We have been trying to make this number not grow more, but we are having a lot of trouble to making it smaller. But we are trying our best. We are getting better at the pain management. We are changing the induced labor techniques so we can shorten it also. We are trying everything. So it's, as I said, it has multiple causes and probably has multiple solutions also. Thank you.
You, Ronnie, and I just wanted to share, I mean, I think you're not alone. I think every single one of the ICI sites, it's a global trend right now. So we're all working together. I'm just looking to see if there's other questions in the chat. Vicki or Vijaya, did you want to add anything?
I just wanted to kind of say, after Ronnie said that, it reminded me of a story. The 12 steps have helped us so many times when the pressure is on midwives, and I think Vijaya mentioned this also. We're in a system where there's high intervention rates, as well as, you know, the too little too late aspect also. But we were approached probably, I don't know, 12 years or so ago in the Philippines by a doctor that was the head of our local Department of Health, and he said, I'm not really comfortable with you know, this natural birth, and I don't know, I'm comfortable with you not doing episiotomy on every first-time mother, and, you know, things like this, inducing everyone at 39, you know, and 6 days. And we were able to, instead of argue the point, just point to the steps. And it went so smoothly because of that, because we could say, well, step 7 has a list of potentially harmful practices. And actually, this one doctor had a complete turnaround on it. So I think the steps can really help us, not only with collaboration when we have, like, normal goes to complicated, but when there's pressure in our system to turn normal into complicated, to want to do all these interventions that we know lead to cesareans. The 12 steps hold us to a more physiological birth. So.
Okay. So thank you everyone for attending this session, VIDM 2025.